Hair loss can be very alarming at any age, and September is Alopecia Areata Awareness Month. That's a disease that impacts 7 million people in the United States. The disease is caused by the immune system attacking hair follicles, resulting in sudden hair loss. So joining us now with more on the condition and where treatment stands today is Dr. Samantha Venkatesh. She's a dermatologist at Rush University Medical Center. Doctor, thank you for coming in.
Thank you for having me. I really appreciate it.
You know, you look at these photos and it really is alarming, but we all deal with hair loss. Either we're born with really thin hair or we reach a certain point in our life, males and females, we start to lose our hair. Yep. Tell me specifically about this condition.
That's great. So alopecia areata is an autoimmune type of hair loss. So it's caused by our own immune system attacking hair follicles. And in most people, it occurs as these discrete circular patches of hair loss on the hair. It can be very sudden and very alarming, and it's a good reason to go in and see your dermatologist if that happens.
Is there a particular age that when it occurs, and then are there certain factors maybe that trigger it?
That's a good question. So it affects about 7 million people in the U.S., so it's a lot of people. 50% of those are actually kids, so less than the age of 16. So especially younger kids, this happens very regularly. Their pediatricians are accustomed to seeing it, but it can happen at any age, happens to both men and women, so it can be very alarming when it happens.
And what about the treatment?
Great question. So a lot of the time, the treatment is focused on treating the immune aspect of the disease. So we can start, if it's just a small patch of hair loss, with things like topical steroids or things that calm down the immune system topically. I often have people come in for injections into the scalp of steroid. Though it does hurt, it can help stimulate a little bit of hair growth and work a little bit faster. But there are some new great FDA treatments that are pills that can help regrow hair.
And those are available now?
Yes, they are.
That's so fantastic. Yes. I love to hear that.
Yes.
I can't, what do you tell patients who come in with something like this? Because it has to be such a debilitating and stressful situation, and you don't want to add stress on top of stress for these people.
Absolutely. And hair is so personal. It's really a part of our identity. And that's the biggest factor when people come in. It can really impact your confidence. So my biggest piece of advice is not to lose hope, to be patient, because we can work on regrowing the hair. It just takes time. But if it's something that's more widespread and things are not working, it's a bit of a thought to consider confidence and beauty, because you're still beautiful despite your hair loss.
Absolutely. And I feel like these days too, hair extensions and wigs are so much more mainstream, thank goodness, for people who need a little assistance.
Absolutely.
Now, is this typically an environmental cause, or is this, let's say my mom had this,
Yes.
Can I then get it?
That's a good question. So there are genetic factors here. There are also environmental factors. We don't really have a great understanding of exactly what is triggering this hair loss. It can run in families, and sometimes people will tell me they've been really stressed or they've recently had a virus, and all of a sudden that's triggered a little bit of this condition to come up. So a little bit of everything, I think.
So you think the best case scenario is maybe don't try over-the-counter things just yet, go see your doctor first?
I think the quicker you can see a dermatologist, the better. One thing you can try over-the-counter in the meantime is a medication called minoxidil. It's sold as a serum, very little harm in trying to put that on a patch of hair loss in the meantime if you're waiting to see a dermatologist.
And that's who you would see as a dermatologist? Are most dermatologists well-versed in the different treatment methods for this?
Absolutely. It's a very common condition. It's something that I see almost every day in clinic. And so your dermatologist will have all the tools to help you in this condition.
Doctor, thank you so very much for your time today. We really appreciate it.
Thank you so much.